Hello, wonderful people. Welcome back to another video. Welcome, Tim. This is Tiny Tim. He is the newest member to our family. I found him in the road October 26th. And he's been a little devil, but a sweet devil ever since. Ah, Tim, he's purring really hard right now. So yeah, I was driving out of my boyfriend's house. Saw this little dude. He was literally like half of his size now. He's so big. I saw him in the middle of the road and I took him home. But anyways, that is not why we are here. I am here to answer common questions about braces. So I looked up some common questions about braces and I'm here to answer them for you. Don't mind my shirt, just another sexy short guy. If you like cool sweaters, give me a thumbs up. If you like cats, give me a thumbs up. Subscribe. Number 1, what are alternatives to metal braces? I would say there's 2, clear braces and Invisalign. Clear, aka ceramic braces. I'm sure a lot of you have seen them. If you haven't, you can just Google it and it'll pop right up. But ceramic are literally just like clear braces. So like the little square things on your teeth, the brackets, they are see-through. So yeah, that is something a lot of older people will get more so than like teenagers, just because they're a little bit less noticeable. But anyone is welcome to get them. So Invisalign, I'm sure most of you have also heard of those too. They're like the plastic trays that you put in every so often whenever they send them to you, and they just slowly straighten your teeth. No, they don't really fix your bites. They just literally take your teeth and straighten them. So why are braces important? So the number 1 reason why braces are so important, it corrects your jaw, just like the function of your chewing. You know, some people have a lot of difficulty eating and braces will fix that. You know, some people, I mean, not everyone has trouble chewing before they get braces. Most people want it for cosmetics, you know, just so they can feel confident in their smile. But a large majority is to fix, you know, your bite. So having straight teeth, you know, after using braces helps keep your teeth clean, which, you know, means less cavities. So that's all around a good idea, right? Braces also allow you to keep your natural teeth. So, you know, if you want to live your whole life with all of your teeth, I feel like a great option would for you to get braces, you know, to keep them all lined, healthy, in the right place, and function well. What age should I get braces? So there is no age limit or universal age that you should get braces. Most people probably get them around, I don't know, I'd probably say like 13, 14. But I've seen like 9-year-olds, probably some 8-year-olds with braces. You know, older people get them too. If you still have all your teeth and you want to straighten them, go ahead, why not? I mean, it's probably best to get them earlier on, just so it's, you know, your mouth is easier to move your teeth and all that. But we can work on older patients and still get good results. So there's really no universal age, you know, to get braces. Can adults get braces? Like I just answered in the last question. yes, you definitely can, and you will get great results. So if you're thinking about it and you're an adult and you want to feel confident in your smile and or want to fix your jaw, you know, your chewing mobility and all that, highly recommend braces. Do braces hurt? You will definitely feel discomfort. And it's not so much hurting, I want to say. It's more like pressure and just kind of like an achy feeling, more so than like hurting. But everyone reacts to pain and discomfort differently, you know? So, you know, you have some people that say it was like easy, didn't really hurt, a breeze, right? And then someone else may say, that was the worst pain of my life, I never want to do that again, I'm so glad it's over. It's kind of like how me and my brother were. I was kind of like, oh, that was easy, you know, nothing to it. My brother's like, I don't ever want to do that again. So once you have braces and you get them, you know, you come in, you get them adjusted, it probably only hurts for about 2 to 3 days. You know, you can also take Advil, Aleve to lower the pain, but you know, it's not gonna hurt until, you know, it's not gonna hurt the whole time. Just the initial like movement of the teeth, and then you'll be fine. How much do they cost? Well, that is different for everyone, especially depending on your insurance and what office you go to and what insurance they take and all that. You know, every office is different. So they're probably like, one office may say this amount, another office may say a higher amount. So it just all really depends where you live, where you go, insurance and all that. For Invisalign, I personally don't work with Invisalign. At our office, we don't do it. But I'd probably say $4,000 to $8,000. That's just kind of what I've seen with people I know that have done it. And I also just looked up the range. So 4,000, 8,000-ish. And then actual braces. Again, it just all depends. But I would say about 3,000 to 8,000 is probably the price range of them. That's kind of a big price range, I guess, but it just all depends, you know, where you live and all that good stuff. So, and then lingual braces. So lingual braces are where you get your brackets behind your teeth. And I feel like a lot of celebrities do this more so than, you know, just like everyday type people. Just so you can't see them because they're always, you know, magazine, shows, all that good stuff. And those probably cost a little more. I'd probably say 10,000, between 5,000, 10,000. I've never seen them done before. We don't do them at my office, but I'm sure it'd probably be an extra charge. So I would probably guess 8,000, 10,000. If you've ever had lingual braces or know anyone or know anything about that topic, leave a comment below and let me know because I'm interested. How long do you have to wear braces? Well, that is different for absolutely everyone. Different for every case. So there's no set amount. But I would say that the majority of people would be 24 months, which is 2 years. That's how long I have my braces. That's how long a lot of my friends and family have had them on. So I'd probably say about 2 years. But again, it all factors in with different things, age, the treatment plan, and your compliance to the treatment plan. So like, if you're not doing what you need to be doing, you know, it's probably going to be longer. Like, some kids will come in, we put them on rubber bands. You know, the last time they came in, we were like, hey, wear these rubber bands. I'm sure most people have seen them, you know, where you wear them from here to here, or, you know, from here to here, different ways to wear them. But we'll be like, okay, wear these. You know, they come back in 4 or 5 weeks, and they haven't been wearing them, and they're like, well, when am I going to get my braces off? And, you know, it pushes time back because they are not doing what they're supposed to be doing. You know, it's not like we just tell you to do this or do that for fun. Like, we're trying to help you get to where you want to be, so you have to cooperate and just do what we ask so you can get to the finish line. How do I take care of my braces? You are going to want to brush and floss. Pretty obvious. Ideally, I guess you would want to brush after every meal, just, you know, just to get the food out so it doesn't sit in there. But at least every morning and at least every night, you know. You don't want food all stuck in there and just building up plaque, right? So at least in the morning and at night. But, you know, if you can do after every meal, do it. That would be awesome too. You want to floss every day, but not everyone flosses every day, and it is hard to floss every day. So at least once a week we say to floss. I mean, we say every day, but like realistically at least once a week, right? Don't eat sticky, hard, chewy things. So if you eat really sticky candy, it'll get stuck on your brackets and just pull it off. If you eat hard things, it'll just knock it off. Be careful when you are playing sports. So if you're playing basketball, football, especially football, I would wear a mouth guard, but any sport really, wear a mouth guard. You know, you can get hit in the face and it'll just pop off. Try not to get into fights. There's been a couple times where kids come in and they got into a fight or something and just knocks off their brackets, and that's no fun. First off, getting in a fight is no fun. Second off, getting your braces put back on is not fun. What happens when braces are put on? It's actually very easy. So first thing we do is we put lip retractors in your mouth. I'm sure most of you have seen those also. It's like a big wide thing. It keeps your mouth, it stretches your lips out, so we can work in there. We put that in, so you're like this the whole time. We put a suction. We let you hold a suction so it gets all the saliva. We dry the teeth off, and then we have two types of liquids that we put on the teeth. We call it the shampoo and the conditioner. So we dry your teeth off, we get the shampoo, put it on your teeth, we wait about 20 seconds, we rinse it with water, and then we dry your teeth as much as possible until it gets like this chalky, frosty look to it. And once we get that chalky look, we're gonna do the conditioner, and we put some on a little pad, put it in the cotton, put it on a cotton ball, like a little tiny cotton pellet, and we put the conditioner all over your teeth, and we dry that off a little bit. We don't dry it to where it's completely off, but you know, we kind of dry it so it's not like wet. And then put the brackets on, and the doctor usually puts the brackets on, so they'll come over, they'll take it out of the little container, put it on your tooth, and then the assistants will come in and put the light on it to cure it. So you don't feel braces being put on. How do braces come off? It's actually also very simple. They take a plier and they just like, I don't know how to explain it. They just like clip them off. You can't feel it. You might hear like some clicking and popping with the glue letting go, but you don't really feel it. So that's pretty easy too. And then once they take the brackets off, they also need to take bands. So like if you have bands around your teeth in the back, they take those off, which also is nothing. And then once all the braces and bands are off, they'll take another different plier and scrape off the glue. And you'll also hear popping and, you know, scraping, but it's not your tooth coming off. And I don't think it really hurts. I don't think it's really painful. It's just more so like the noise of it is just kind of scary. So how often do I come in? It just depends on what we're doing that day. And you know, so sometimes it's 2 weeks if you're just starting. If we put spacers in you to get started, we'll see you in like 2 weeks. If you already have braces on and you're coming in for adjustment, it'll be like between 4 to 6 weeks. Or it could be 8 weeks with palate expanders and things like that. So it just really depends. But if you have braces and you're just coming in for adjustments, it's probably between 4 to 6. With that question, I thought I'd throw in like how long are appointments. Again, it just depends. For our actives, like people that have braces on, they come in to get the color change and all that, it's usually about 30 minutes, 20-30 minutes. How often should I brush my teeth? I kind of already answered this one, but at least twice a day. And a lot of kids will come in and they'll say like, I brush my teeth, like they don't have very good hygiene sometimes, and they'll say, I brush my teeth like 4 or 5 times a day, but they don't know exactly how to brush their teeth, which is why we have to go in and show them. But they'll just like go real quick and just, it's more quality over quantity. So we'd rather you brush at least twice a day, you know, getting around every bracket, than just real quick 4 or 5 times a day, you know. So quantity over quality for sure. How long do I wear my retainer? So we're going to tell you to wear your retainer for 2 years full time, and then you'll probably switch over to nights. If you get the lower lingual, so the bar down there, you will have that in for probably at least 7 years. Every office is different and all that, but probably around 7 years. Some people keep them in longer. Some people get them out before the 7 years for whatever reason, but probably at least 7 years. Lastly, can braces be removed temporarily? And the answer is yes. So there's been a couple people that I've seen, they'll come in and for like engagement pictures, wedding, or whatever the reason may be, we'll take them off and they do what they gotta do. They come back in and we'll put them on. But for the majority of the time, we'll usually just take off the uppers and not the lowers, just because the uppers are obviously more noticeable. So instead of doing the whole mouth, we'll just do the upper arch. So some places may make you pay a fee to take them off and put them back on. So just keep that in mind. So that was my 15 most common questions about braces. I hope you found what you were looking for. If you had a specific question, I hope you guys liked this video. Hopefully it was informative in some way to you. So give me a thumbs up, subscribe, and leave a comment. And yeah, and I will see you guys in the next video.